today more than ever, it's actually really easy to get labs. So I want to talk to you guys about what we look at every single day in the hospital, taking care of critically ill patients, versus maybe you guys are ordering these online lab studies and getting this plethora of labs back to you. And it's like my parents always, they're like, oh my God, I got my labs and this thing is abnormal, when it's actually low, which is meaningless, or like 1 point out of normal. So every single day we look at what's called the basic metabolic panel. So it's going to give us our sodium, our potassium, our chloride, our CO2, our BUN, our creatinine, and our glucose. So on here, sodium's extremely important because that's going to control your serum osmolarity. So that is the most important electrolyte, if you will. However, potassium's also extremely important because this can have a lot of different issues with the heart, and when you go into renal failure, so creatinine and BUN are indicative of your renal function, this can become elevated and that becomes a big problem. Glucose, obviously, for most people, we're aware, if you have high glucose levels, you could be a diabetic, right? So we're always looking at this and we want to make sure that the blood sugar is well controlled. All right, then we look at a CBC. So over here you have your hemoglobin, very important. It carries oxygen, and we're going to know if you're bleeding long term, as you guys know, and then your white blood cell count, and then your platelets. So your white blood cells are going to fight off infection, and your platelets are going to form clots. Everything in your body is in homeostasis. There's other important electrolytes over here, such as your calcium, your magnesium, and your phosphorus. We like to check all of those. And then over here, there's your coagulation profile. So you could have your PT, PTT, and your INR. This is how well your blood is clotting. And then in the ICU, we typically also like to look at an arterial blood gas, especially on patients that are on the ventilator, to see how well we're oxygenating and how well we're ventilating. So every day, these are the main things that we are looking at. Now, to add on to that, when people nowadays are sending these at-home blood tests, a good thing to get would be a lipid panel. So you can get your triglycerides, your LDL, your HDL. These are all going to be markers of whether or not you're going to be prone to developing atherosclerotic disease, because the number one reason